I always exercised my whole life, and I've always been very, very active. I was diagnosed with a disease I actually didn't have, and they put me on very heavy-duty steroids and chemotherapy. My husband says I'm the only person he's ever known that had recreational chemotherapy. But it powdered my bones, and I got osteoporosis very, very badly. It felt like I was made out of matchsticks for about 1.5 years. Every time I bent over very far, I'd snap a couple of ribs. And I actually broke 2 vertebrae putting a chicken in the oven. So I don't recommend, drink your milk. If you're young, drink your milk. It was hard to find somebody who didn't have a one-size-fits-all. At the time, I think they were kind of giving everybody, or most pain centers were giving everybody morphine, time-release morphine. I did not like having to depend on morphine because when you're taking heavy-duty drugs like that, you're going to be sick if you miss one. And it's not a good feeling. You're addicted, but you need it. And I didn't want to live like that. I wanted to explore other options and see if I could get off of all this medication.
I started building the pain center in 1990, and it's grown from seeing about 60 patients a month to almost 850 patients a month. So we're doing a lot of good for a lot of people, and I've enjoyed every minute. I do not believe that narcotics are the answer for chronic non-malignant pain. I think over time it reduces patients' quality of life, so we try to replace the narcotics with non-narcotics and wean them off the narcotics.
People think that pain management is a lot of drug therapy. Medications are a part of pain management, but it's not the whole thing. It will be a combination of therapies. It'll be nutritional services, it'll be physical therapy, and it'll be a lot of professional advice to get people to maintain their quality of life without being just on medications. The side effects of medications are never good.
I had days where I felt really hopeless. I wondered if I'd ever be able to do the things that I wanted to do again. I had a lot of expectation of my life, and it wasn't going the way I wanted it to. I wanted somebody that would give me some hope, and I found a lot of hope at North Fulton Pain Center. They were the first people that said, we have other options.
Most of these patients that come to see us have been through many physicians and maybe other practitioners that have told them things that they can or cannot do for them in hopes that they could get some pain relief. And when we finally get them to being better and feeling good about themselves, it's like someone has turned on a light. And that is an amazing feeling.
Gosh, I'm always looking for hope. I'm always looking to do better. I'm ready to do better. I'm ready to feel better. And the first time I talked to Dr. Joel and then Dr. DeMama and Dr. Wada, each one of them brought something new and a different aspect to treatment, and it has just evolved.
We frequently collaborate on difficult patients to get each other's ideas. It allows another physician, like Dr. Domina or Dr. Wada, to see maybe a patient I'm treating and put a new set of eyes on it. He may get some ideas that I didn't have. And the same with me. I'll see one of their patients and evaluate them, and I'll have ideas that they didn't have.
The most recent thing that we have found is radio frequency. And that seems to really have made a big difference. I had one sciatic, one side done, and I've got an appointment to do the other side. I can't wait.
Jody is a very interesting patient. When I first met her, She had tremendous amount of pain in her lower back. She received a procedure called the Simplicity procedure. Simplicity is a radiofrequency of the SI joint. It may sound very simple, but in decades, there has been a lot of difficulty getting an adequate radiofrequency of that region. Classically, other pain providers, interventionalists, would radiofrequency this by placing 20 plus needles between the SI joint and the sacral foramen to get some relief. In Europe, there were these studies that were done on this very specific needle that was created to mimic the actual sacrum. It has a curve that's placed right in between the sacral foramen and the SI joint. Bottom line is, it's the most effective treatment for SI joint pain.
I was very, very pleased, and I had immediate relief, which shocked me. I expected there to be some pain from the procedure, and I don't know if that was a fluke, but I did not have any pain at all. They told me it can be up to a 4-week recovery, but I didn't miss anything.
Jody is a great example of someone that has, unfortunately been misdiagnosed for many, many years, and now that she's finally received the right procedure, it has changed her life.
One of the best things a patient ever said to me was that I was sitting in the room with them and he said, quote, unquote, was, "You've improved my quality of life so much so, and you've brought my pain down to a level that I've never felt this good before."
I actually can just go to bed and go to sleep and sleep through the whole night. I can't even, I can't tell you how long it's been since I did that. And when I get up in the morning, when I open my eyes, I'm not grabbing for pain medicine in order to be able to get out of bed. I can get up and I'm getting up and getting my own coffee. My husband usually brings me coffee because he knows I have such a hard time moving in the morning. I'm actually getting up and making the coffee for both of us. When I play the piano, it just makes me feel like I'm exercising my brain. Now I can sit there and I don't have to worry about it, and I'm not thinking, oh, I'm going to have to take a pill and wait for it to kick in before I can sit down and play some more. None of that is happening. I'm actually living my life without being encumbered by the pain.
If you can be in a setting that you can look at what you're doing now, whether you need physical therapy, whether you need surgery, might be the case. People will often put it off until they are so sore, so debilitated with pain that they can't hardly function anymore. And the whole purpose of pain management is to have people function as normal as possible.
If you hurt, do something about it. Don't pretend that it's not there. Don't try to ride it out. It's hurting you in a lot of different ways you may not even realize. There are things that can be done. Don't put it off. Go and see help. And of course, I'm a little prejudiced. I think you should go to North Fulton Pain Center.